All right. Hello, everyone. Happy Halloween and welcome to Q&A with Tech Services. I'm Olivia Radcliffe and I am here with the incomparable Dan Yasenchak. Dan, who are you and what do you do?
I am the Director of Technical Services at eBeam Services. And what I do is try to learn what your needs are as a potential client and figure out if eBeam Services is the right solution. So that's how do we go ahead and figure out if we can get good properties out of your product by exposing it to the electron beam, and then how do we do that cost effectively on a production basis. So we do about 30 or so experiments per month here at eBeam, and
Wow.
yeah, yes, it's not just me. I like and some here. We have a lot of people who do the work, which is really good for us. But yeah, so lots of really smart people that I get to talk to, and that's the start.
Yeah. Well, and obviously there is a lot to learn with eBeam and different products and how it works and functions. And so that is why we're here with Q&A with Tech Services to help get your questions answered as well. So we have some questions here we're going to go through. Dan's going to do his best to answer them. And yeah, we'll go from here. You ready, Dan?
I'm as ready as I can be.
Okay. All right, so the first submitted question is, what kind of ongoing support do you offer clients to ensure they're maximizing the value of your services? I feel like I'm on a game show.
So can I get a multiple choice answer? Yeah, actually, can you go ahead and re-ask the question? Because I believe this is a communication answer, but I want to make sure I understood it.
It is. What kind of ongoing support do you offer clients to ensure they're maximizing the value of your services?
Yeah.
How do you support clients?
Yes. So that is a very, very good question, because there's a lot of times where I think people view the service provider as just saying, oh, you're a customer, you're, customer number, 127, and I don't really care about you. You just send your stuff in, we process, we ship it back. At eBeam Services, we do try to strive further, and we try to have at least annual calls with you to go ahead and understand, hey, how has your business changed? How are things maybe improved? Things you find annoying with eBeam Services, because not everything we do is, perfect.
What,
but
you annoying, Dan? Never, never.
I know. But there are opportunities on both sides a lot of times to find, synergies that where you can work together to find a better way to go ahead and maybe, package something, ship things. And it is kind of the whole gambit. There are many times where in these conversations, there's always the question of, hey, are we allowed to visit a facility? And we enjoy you visiting the facility and seeing what we have to offer, what it looks like. And pictures kind of don't really do it justice. It's a pretty big facility at either one of our New Jersey or Ohio facilities, and it's something that seeing it helps provide so much more understanding. And it's the same thing for us. If we can go visit you, it's also a lot of times there's things that we suddenly realize, oh wait, what are you doing there, and how does that work? And so that's part of that is really the communication. So if there's something that comes up on your end, reach out to our customer service manager. You know who that person is, and it's very much a relationship based conversation that can be had there to figure out, okay, well, is there something more that we can do? And again, we want to get that feedback. As we view it, it's, if you have a complaint about why do you always go ahead and ship the pallets at a 90-degree angle from how we really like it? Well, if we don't know that, we can't fix it. The other side of that is, if we don't understand your system, there are things that, oh, well, it's really convenient for us to ship it this way, but you need it the other way. Okay. Let's have that conversation. So we really view it as a gift anytime we can get that feedback. And if you want to call it a complaint, it's a complaint, but it's really an opportunity for us to work better together. So please do communicate with us.
Yeah, I like that term you use of relationship-based conversations and such, because that is what you're looking to do. You just need to have open communication, right?
Yes, and there's so many. Yeah, there's so many customers over the years since I've been here for over 2 decades. Which is old. But that the not surprisingly, business have changed over 2 decades, and we've been able to go ahead and have those conversations. And when things stand out to us that we notice, that it's like, hey, we noticed that there's a new color. What's this? Or what's going on? It's suddenly well, it's an opportunity to have a conversation. What's going on in the business? And we like I said, we encourage those conversations.
Yeah. Okay. Next question. Is your process safe for food or other sensitive products? And how do you ensure compliance with those industry standards?
Again, good question. We don't do food processing. It's not necessarily the greatest fit for how we have our operations set up. And eBeam certainly, well, there's a company that's very well focused in that area, so it can be very safe and effective. For the products that we do that are sensitive, particularly when I think of pharmaceutical, tissue processing, there are standards that are related to those that we follow to, I want to say, stay in compliance, sure, but it's also best practices that have been learned over the years, which it goes into those standards. When we go ahead and qualify product initially, there's absolutely a step in understanding again what are the requirements that are needed. So certain times we irradiate tissue, it's to sterilize it. There's times you irradiate tissue to decellularize it. Well, those aren't the same thing or same application.
Mm-hmm.
What do you need after that, after it's been irradiated? Is it structural integrity? Is it no, we just need it to be exactly the same, and don't change it. What are those things that are most important? So it's kind of a two-part answer. Is one, we follow the standards, stay in compliance, and trust me, the FDA audits us frequently. So apparently there's each market in sterilization, they audit you. So those have all gone very well this year. But there's a regulatory aspect, but then there's again, it's to go back to the previous question, it's the communication we need to have and make sure, and that's part of, again, my job, our team's job on the front end here in tech services, is understanding what your needs are. How do we help you achieve the results you're looking for, or find out that sometimes even electron beam isn't the right solution, and that can happen. In the realm of some of the pharmaceuticals and tissues, the way we have to look at it is, what are those other ways to process things to cause less change in the chemistry, and that's where we offer the dry ice processing and things like that. So I think that's my answer.
Good answer. Okay, this one is you can get personal with this one. What has been your favorite project to work on at eBeam?
Okay, I've been here for a really, really long time. So that's like a really difficult question to answer. I think in the realm of my short-term memory, so something that I've worked on in the last year, there are some, and again, everything's covered by a CDA, NDA, so I can't share everything, but it's been a project that I think we're about 2 years into it, and we're just getting our first production, or well, really our customer is getting their first production order for a product that is ultimately far more environmentally friendly. It's not an oil-based polymer that they're working with, and they've really taken this product from very how do you want to call it? How can we even do this? We think there's a potential here, and they got us involved so early in the process that's been the part that's been so exciting. Mm-hmm. And hey, they've been here multiple times. We've been to their facility multiple times and trying to figure out, okay, how do we make this work? And trust me, we're no one's happy with our so-called production process at the moment. From their standpoint, our standpoint, from the, hey, it's still very much a pilot phase, but we know how to produce really good product at this point, and it's kind of the scaling up that just has to happen. And looking at the number of iterations and how fast this company has worked in going through these different steps and giving feedback so rapidly, that it's just been fun to be part of something that starts like, so, hey, here's the concept, and you're like, how you can't do that? Yeah, they can. They got a team of PhD, really smart, really capable people. The ones who don't have PhDs, they're like, they have everything that you need beyond it. Just incredible team to work with and get to know, and in the end, see this product that I want to say is really kind of going to revolutionize, I think, a industry, and create something that's great. We get to deem it. It's more business for us. That's a win. Sure, that's how I get paid. But the other part is, something that you look at in the big picture of the world, of something that's really a better product out there than what currently exists, and such a better footprint, on the environment, much less impact. So just that's been really neat. And as a person who does like the bike back and forth to work, and be out in the nature, and watch the deer and the turkeys that happen to be out there this morning. I enjoy that aspect of the job of look, the e-beam technology, it's a greener technology. It's this product happens to be a really green offering.
Yeah, I love that. I will say, from my time in tech services there, the number of times that I saw something that was supposedly impossible to do, something that shouldn't have been able to be done, and then watched it happen, was just, I mean, that was mind blowing, to come and work every day and see those impossible things happening. And it's life-changing stuff, like you said. I remember my niece was in the NICU at the time, and we were working on a project for the NICU, and it was like, I had a very emotional connection to it. And I loved that we were helping do that, helping make things better.
And I think there is something in the DNA of e-beam. It's part of why I've been here for so long, is, we're willing to have conversations about things that, like you said, seem improbable.
There you go.
Impossible. It's like, hey, can you do that? Maybe we can. And yeah, there's a lot of really wonderful things that our customers are doing, and so it's easy to pick on a whole bunch of them, but that's the one that has been most fun in the last year and a half or two.
Yeah, I love it. All right. Next question. Let's see here. Can you talk about the conversion process from ETO?
So one very good question, particularly with the additional EPA standards on ETO, and obviously there's I shouldn't say obvious, but if you haven't followed the news at all in this regard, there's been a lot of litigation about ETO and the carcinogenic nature of it, and to have a story of no ETO would be really difficult, because ETO works really well. It's been out there for years. That's why everybody kind of considers it often early on in product development in the past. And it accounts for probably 50% of sterilization medical devices right now. But it is a carcinogenic gas. I mean, it's how it kind of does its job. The conversion process from ETO to e-beam, there's, I think, what I would qualify as two main challenges. One is material compatibility. So ETO works for a lot of polymers, I would say more so than irradiation does. There are some drawbacks on certain polymers with ETO. But when you go ahead and look at, some particularly already made products, therefore conversion, as opposed to, you're starting up with a new product. The challenge can be, well, but this, and again, literally got a list of materials. There were 40, I think it was 47. So sorry, maybe don't cite me exactly on that, but but there were 47 materials in it, and that's a lot of different materials. And if it's all compatible with ETO, I'm afraid that there's going to be at least a couple in there that aren't going to be compatible with E-beam. And in this case, there were several that were in the adhesive, and that minor changes there, were going to cause a change in functionality of the medical device. So it's something where it's like you'd have to redo it's kind of a major filing change and qualification. Then you have to go through testing and potentially even start having to redo clinical testing, which then now you're talking about probably million or plus dollars. So things that are really not a good fit is when you're in a situation like that where you can say, oh man, there's all these materials. Things that are a few materials, I think my number has been 8 or less. There's like statistics that say if there's 8 or less materials, you still have a pretty good shot that it can work with E-beam. Once you get over 8, your percentages go down pretty dramatically. But the looking at the materials would be kind of a first evaluation, and then the next part is what about density? So with electrons, small variations in density of the product can be pretty substantial. There is absolutely limited penetration that the electrons can get through products. So there is a real evaluation that has to occur there. If those two things look pretty good, then we can go start really into the E-beam qualification per 11137, and that's really well defined. And we're not going to go ahead and answer that now because otherwise everybody will fall asleep. But that's not necessarily answering, how do you convert it? I think the first part is how do you evaluate it, and that's really the part I'm trying to answer here is well, let's look at the materials. Let's look at the product density, how it's packaged. Is there flexibility in how it's packaged? Can that be changed? So there are certainly number of products that we have worked on that we have gone through change, and the ones that are biggest problem that we've seen are, like I said, a lot of materials, or they have Teflon, PTFE in it.
Mm-hmm.
That just is not a great material for irradiation sterilization. It's actually some challenges. I think even EO has, it's such a unique polymer. But that's, if I can go ahead and kind of draw a immediate thing. The other part is if there is polypropylene, it really needs to be a radiation stable version of polypropylene. So there are definitely, like I said, opportunities out there on, things like just at a trade show, and they had gown kits there. And it's like, as it turns out, those are EO sterilized, but it really looks like a nice fit for E-beam because there's a number of materials. There's more materials than you think in a gown. There's multiple layers. There's the tie. There's there are adhesives, but there's a lot of fit there that also works. So, but yeah. So again, start with the evaluation of let's look at materials, and then let's look at density, and then where we go from there is normally with a material exposure where we expose the samples to 2, maybe 3 dose levels and see, well, does it still function the way it's supposed to?
Yeah, perfect. So ultimately, start with a phone call to you to talk through it.
Yes, for one of our technical services. Yes.
Okay, perfect. I like that you've said a couple of different times throughout this call that E-beam can be an amazing fit for some things. Some things are not a great fit, like PTFE and the non-radiation stable polypropylene. And I think that's maybe an important thing of, it's not a solid fit for everything. And that's why there are other sterilization methods out there, because most importantly, and I've heard you say this multiple times, we need to sterilize things and get it out in the world. So that's what it is. And the ultimate best thing is to come back and have a conversation and see just what is possible. Look at your materials, look at the packaging, the density, and just kind of go from there and figure out whether e-beam can be the best fit and vice versa.
Yes. And I mean, and just add one final thought, even in what you just said, there are times where people approach us and they're like, oh, we have this product that could fit probably with you, but we have way too much volume. You can't handle, our truckloads that you have. And it's like, well, how much volume are you talking about? And it's like, oh, we have 2 truckloads a week. And it's like, unfortunately, I guess I haven't done that good job in sales yet, because we have that capacity times like 10 available right now. So, we have available capacity for high volume. So when you think of a conversion, that is one of the things that, the supply chain people obviously want a really, good answer, and not just a single source. Oh, that's why we have 2 locations. There's New Jersey, there's Ohio. We have 4 beams, 2 beams of, each location that can do that sterilization. We'll go ahead and cross qualify as needed. And, so it's that there is the other half the answer of things that are, okay, well, can it even be done? Well, if it can, we also have a solution of let's do it in production. And, I don't want to hold that back from hey, is there a fit here or not? The reason I haven't talked about that part is because I just kind of assume naturally, yeah, we have this capacity. Everybody should know that. Well, here's my way of trying to let you know that.
No, that's actually a really good point though to bring in, because that is, we always talk about that experimental phase. Does it work? Is it a fit? And that whole there's the whole fact after that. Once we go through the experiments, your 30 experiments a month or whatever you're doing, then there's production. And what does that look like? And knowing that there is that out of capacity and the backup capacity, with the multiple facilities and multiple accelerators at multiple facilities. I mean, that's a huge point right there, because that helps with that ultimate turnaround time and getting the product to the customer, right?
Yes, exactly. And that's, yeah, you've said it well.
Okay. Thank you. All right. We'll wrap this up then and let people get back to, I don't know, whatever they do during the day at Halloween. Gotta be candy somewhere, right? All right. Well, thank you for joining us for Q&A with Tech Services. If you have any additional questions, anything you want to have answered, either on a call or privately as well, you can go ahead and fill out a contact form at ebeamservices.com, or go ahead and shoot Dan an email at ebeam@ebeamservices.com, and they'll get back with you and get your questions answered. All right. Any last minute bits of wisdom, Dan?
Not today. I think you should just enjoy your Halloween and, the month of November as we approach Thanksgiving.
It's Christmas time now. Okay. Time for Christmas music.
Oh, we need gifts. Huh.
All right. Take care. We'll see you next month.
Very good.